Hi, I'm Dr. Ted Arkfeld with the Clinical Genius Program. A lot of doctors are probably asking right now, what do we do? What do we do now? The coronavirus has just created so much uncertainty. Well, over the next few days, I'm going to be sending you video emails regarding what you can do in your office to get back to profitability and to create your own economic stimulus. I've been in practice for over 31 years, and the one thing that I have come to realize is that chiropractors are tough. We've had doctors go to jail for practicing without a license in our history. We've had a concerted effort to get us out of healthcare. We've had insurance company have bias against us as a profession, and we're still here, and we're going to still be here when all of this craziness is in the rearview mirror. So what I'm going to go over with you is 3 steps to increase your revenue and how to create your own economic recovery. The first thing you have to do is to stop the revenue leaks in your practice. And I was one of the first chiropractors in 2007 to become a certified professional coder. I get it. That sounds absolutely boring to most of you. And I put it off for a while too until I realized coding is the way we get reimbursed. And if you do it correctly, you can give yourself a raise. So I'm going to discuss the first step in your economic recovery is evaluation and management codes. Huge revenue leaks in offices nationwide. Not only do these codes represent revenue leaks, but they are essential to establish medical necessity. Let's say that you do 99201 for every new patient, yet that patient needs 38 visits or even more because the severity of the condition just requires that duration of care. A 99201 is not going to establish that type of medical necessity. So let's get into the codes, the established patient codes, and then what incorrect coding can lead to as far as a revenue leak. The 4 codes that we will use in chiropractic for a new patient, this is a patient that has not been in your office ever before, or they've been in, it's been over 3 years since they've been in. 99201, 99202, 03, and 04. Established patient, 99212, 99213, 99214, and 99215. Noticeably absent is a 99211. You shouldn't even be using that code because doctors, you do not even need to be present in order to use that code. These are the fees from Blue Cross Blue Shield of Michigan for our E&M code. So just plug in your own fees when we get to that point to determine if you are indeed losing revenue. And visiting hundreds of offices nationwide and meeting thousands of doctors since 2007 when I was doing compliance consulting, I have yet to meet an office or a doctor that were not losing money on E&M codes. So 99201, 99202, 03, 04. When do we use 99201? We use it in our office for kids. 99202 for an adult with one area complaint, 03, adult with 2 or more areas of complaint, 99204, pretty severe condition. 99211, again, we don't even use that. 99212 for kids, 99213, one area complaint, and 99214, 2 or more body areas of complaint. What am I talking about when I say body areas of complaint? Neck and arm pain, neck and low back pain, low back and leg pain, full spine, 2 body areas of complaint. So you'll see as we go down, the prices go up. The fees that we would get reimbursed go up. It also sets a stage for medical necessity. So let's say on one new patient per day, and you have 5 new patients a week, let's just say you have 20 new patients per month. At one new patient per day, and if you are doing 99201 and only that would be 4923, when in fact maybe 99203 would have been more appropriate. You're losing $67.16 per day on that. On the surface, hey, not that much, right? Well, you start adding that up, and over a week, it's $335. Over 4 weeks, almost $1,400. And at the end of the year, off of one incorrect code, now that's $16,000 you just lost. Let's do an established patient. Same thing happens. You're doing 99212 when in fact maybe the most appropriate code would have been a 99214. That's a loss of $68.31. Okay, on the surface again, maybe not a big deal to you. However, take it times 5 days, $341, times 4 weeks, almost $1,400 again, and at the year, you've lost $16,000. Now, for just those two codes on a yearly basis, you're losing $32,512. But again, plug in those fees with your individual insurance fee schedule and see what kind of loss of revenue that you're having. And if you're not doing re-exams at least every 30 days or with change of condition, there's even more revenue loss for you. Now is the time. Get training on how to choose the right code. There are documentation requirements for each code, and we can train you how to select and document the most appropriate code. Develop an examination flow. I've been amazed on how many times I've gone into a clinic and they have no real flow for their examination. They just kind of throw it together. When you do that, you can lose bullet points that would lead to a higher code, and you're inefficient. And right now, you got to get efficient. You have to get things streamlined so that when it's time to go back to practice full time, when all these restrictions are lifted, you get back and you can restore profitability very quickly. In our next session, I'm going to go over some things that I want you to really think about. Maybe it's time you change the way you practice. Maybe it's time to get away from passive care, manipulations, and maybe a massage-based type of practice into more of an active type of practice, active care, low-tech rehab. I call it the neural way to practice. And if you think E&M coding is costing you money, not doing low-tech rehab in your office is staggering, the amount of revenue that's going out the door each day. I've heard all sorts of excuses and reasons why you can't do low-tech rehab. We're going to put those to rest in the next session. Here's my contact information. Feel free to send me an email, Dr. Arkfeld at arkfeldchiropractic.com. I'll tell you what, you send me an email, and I will send you a free copy of my latest ebook on the 5 mistakes chiropractors make that's costing them money. And so I'll send that out to you right away. Tomorrow, stay tuned because I'm going to send you another one of these video emails talking about active care. We are in this together. We're going to get through it. And remember, pain doesn't know that there's a virus out there. That's what I've been telling my patients. That's what I've been telling other doctors out there. Patients need us. The world needs us. I'll talk to you tomorrow.